What are the side effects of oxygen therapy? If you or a loved one is considering oxygen therapy, you might be wondering what kind of side effects you could experience. Let's break it down to help you understand what to expect. Oxygen therapy is generally safe, but like any medical treatment, it can have some side effects. One common issue is a dry or bloody nose. This happens because the continuous flow of oxygen can dry out the mucous membranes in your nose and throat. To avoid this, you can use a humidifier attachment with your oxygen concentrator or apply a saline nasal spray to keep your nasal passages moist. Another side effect is ear and sinus pressure. This can feel similar to the pressure you might experience during changes in altitude. You might feel ear popping or sinus pain. To alleviate this, you can try swallowing, yawning, or doing the Valsalva maneuver to equalize the pressure in your ears. Fatigue and weakness are also possible, especially when you first start using oxygen therapy. This is because your body is adjusting to the increased oxygen levels, and it may take some time to adapt. Starting with a lower oxygen flow rate and gradually increasing it, as advised by your healthcare provider, can help minimize these effects. Oxygen therapy can also cause headaches and morning dizziness. These are usually mild but can be uncomfortable. If you experience these symptoms, it's a good idea to talk to your doctor, who can recommend ways to manage them. For those using hyperbaric oxygen therapy (HBOT), there are additional risks to consider. HBOT involves breathing oxygen in a pressurized chamber, which can increase the risk of lung damage, including a collapsed lung. You might also experience fluid buildup or rupture of the middle ear, sinus damage, or temporary vision changes like nearsightedness. Oxygen toxicity, or hyperoxia, is another potential issue, especially with prolonged exposure to high concentrations of oxygen. This can lead to symptoms like headache, dizziness, confusion, and nausea. It's crucial to monitor your oxygen levels regularly and consult with your healthcare provider if you experience any of these symptoms. Lastly, there's a fire risk associated with oxygen use. Oxygen is highly flammable, so it's important to never smoke or use flammable materials while using oxygen. Ensure your oxygen tank is secured and stays upright to avoid any accidents. In summary, while oxygen therapy is generally safe, it's important to be aware of these potential side effects and take steps to mitigate them. Always follow the advice of your healthcare provider and take necessary precautions to ensure a safe and comfortable treatment experience.